for kindness. So, close your eyes. Take a few moments to breathe in and breathe out. But I would say on a deeper level, it's more like when we say work on yourself, that involves all kinds of like things about moving your life forward. And they struggle with
motivation in these things.
It's because when I don't think I'm worth it, I'm not worth fixing.
When you develop empathy and compassion for other people, there's going to be room for someone else in the relationship. And then this in turn is going to reduce the feeling of being an object. Now two people can connect. And now it's not about getting your needs met in starvation. It's about two human beings forming a relationship.
Alrighty, chat. Let's get started. Welcome to another Healthy Gamer GG stream. My name is Dr. Alok Kanoja. Just a reminder that although I'm a psychiatrist, nothing we discuss on stream today is intended to be taken as medical advice. Everything is for educational or entertainment purposes only. If y'all have a medical concern or question, please go see a licensed professional. So today we've got a super awesome stream guest who I hope is coming, and hopefully nothing fell through. But we are hopefully going to be talking to Dr. Kirk Honda from Psychology in Seattle, who's an expert on personality disorders. So, you know, I have some experience with personality disorders. So, like, I do deal a lot with more cluster B stuff. So for those of y'all that aren't familiar with this stuff, I do a lot of work with people with sociopathy, narcissism, and borderline personality disorder. Those are really like what yeah. So that's kind of where I have a lot more clinical experience. And hopefully today we'll be talking with Dr. Honda about avoidant personality disorder. So I have tons of questions about it. We have a couple of posts that we can look at, but I think it's something that's actually really relevant to this community. So we'll hop into that as soon as he shows up, and hopefully this isn't a problem on our end, like he doesn't have the link or something, which sometimes happens. Because, we're still noobs at this. But while we're waiting, I think we can just vibe. And then, yeah, we'll see what's going on. I'm going to kind of double check into this and make sure that I'm not doing something wrong, because sometimes, as chat knows, I'm a noob. There we go. Okay, let's see. Oh, okay, he's here. All right, great. Okay. Hey, Dr. Honda. Oh, can you count to 10 for me? Are you muted by chance? Okay, hold on. I think it's me. What? Yeah, I can hear you fine. Say something. Count to 10. Perfect. Okay, let me just fix this overlay. And then let's dive in. So we're going to see if this hopefully works. Crossing our fingers. Oh, and hold on. We got this. There we go. We fixed it. All right. Hey, Dr. Honda, how are you? I just got to fix sound. So count to 10 for me one last time.
1, 2, 3, 4, 5, 6, 7, 8,
Perfect.
9.
Perfect. Thank you so much. So I just did our intro. Just a reminder to everyone that Dr. Honda is also a medical professional, but nothing he is going to say today qualifies as medical advice. Anything that y'all have a medical concern or question about, please go see a licensed professional. Sound appropriate, Dr. Honda?
Absolutely.
So I was just telling people that you're an expert in in personality disorders.
Yep.
But do you want to start by just telling us a little bit? And I think today we're going to be talking mostly about avoidant personality disorder.
Okay.
I love how he says, okay. So if there are other things that are available, cool.
Yeah. Well, we had brainstormed lots of things. So
Yeah.
I sort of mini prepped a lot of things this morning, but yeah.
Yeah. Do you want to tell us a couple of the other things that you kind of thought about or talked about? I know we prepped, as you said, for a lot of things.
Well, yeah, we talked about schizoid personality disorder as well, and maybe just about loneliness in general and what can cause isolation.
Yeah, awesome. So that sounds great. I'm personally curious because I've worked with very few schizoid people in my clinical career.
I don't usually come to therapy. So,
Right. Yeah. So I think I would love to hear about that. But do you want to tell us a little bit about kind of who you are, where people can find you on the internet?
Yeah. I have had a podcast and YouTube channel called Psychology in Seattle since 2008. And we do all sorts of things, podcasts and reaction videos and deep dives and lots of things.
Yeah.
But I've been a therapist and a professor since the late 90s.
Wow. So you were doing podcasting before it was cool.
Yeah. I don't know why, but I was.
Yeah.
No one was listening, but I was doing it anyway.
And what kind of stuff can people expect on your podcast?
Yeah, I have a hard time elevator speeching it because on one hand, we'll do a deep dive on a personality disorder, for example, and I'll research for 6 months and talk for 12 hours, and it'll be from several different angles, and I will feel like it is a mini dissertation. Or I will react to Love is Blind and just go, what was that? And I'm never diagnosing from afar, but I am using it as a launching pad to talk about relationships and attachments and conflict resolution, infidelity, that kind of stuff. Or I'm talking with one of my co-hosts who are all really good friends of mine, and sometimes we're reacting or we're responding to emails, or we're talking about a movie we saw. It when you create 20 episodes a week, you got to keep the needle moving. And so
You make 20
there's,
episodes a week?
I mean, it depends on the week, but yeah.
That's
Yeah.
insane, dude.
Well, yeah, but my understanding is you work a lot as well, so you know the drive to like keep going.
Sure, but I mean, I didn't mishear you. You said per week, not per
Yeah,
month?
yeah. Like right now, Love Is Blind season 7 is on, and so I always will react to that
Okay.
because it's my favorite reality TV show, and so I will put out 2 episodes a day just
Oh,
for that. But then there's
interesting.
also the audio
Okay.
about podcasts and stuff. So
Yeah. That's so cool. I think here's I think your channel is phenomenal, and I
Oh,
think
thanks.
part of what I really like about it.
Yours, by the way, but I'm quite honored. I never thought that you would even know who I was and give me the time of day, let alone have me on one of your videos. So I'm quite honored by this.
Well, we can. You're very welcome. I am equally honored because you've been a professor since the '90s. I was like in elementary school in the '90s. So to have someone of your experience and just breadth of stuff is super cool.
Yeah.
And I think strongly recommend everybody check out your channel. And I think it's a really good fit for people in our audience because, like you said, I think I think a lot of people come here because they want mental health in different ways, right? So like sometimes it's a conversation, sometimes it's like a deep dive or like dissertation, sometimes it's like, and I think you do react content incredibly well.
Yeah.
And so I think you do a fantastic job of taking things that are entertaining and already people are like watching or into, and then you sort of make like learning about psychology, psychiatry, and mental health like fun and in a more packageable way. So strongly recommend everybody check out Dr. Honda's channel.
Yeah, I kind of fell into it at the beginning of the pandemic. I was bored like everyone else during the initial days of the lockdown. And I had heard of this show that everyone was talking about called Love Is Blind. And I never watched reality TV. But I'm sitting there with my wife and I'm like, well, we have all this time to kill. So I started watching it and I found myself actually liking the show and bothering my wife with like, no, they shouldn't be doing that. They should try this thing. And I was like, maybe I should stop bothering my wife and I should just bother the internet with this. And then I didn't think anyone would watch, but it sort of blew up and then, here I am.
Yeah, that's cool.
But yeah, it is along those lines of like finding things that people are already interested in. Because, I've been podcasting since 2008, trying to break through the SEO on some level. And whenever people would find me, they would say, I can't, you need a better SEO or something. Because I just, I finally found your content and you've been doing this for so long. Well, the trick is if you sort of jump into the stream of content that people are already Googling, then you have a greater chance of actually coming across people's feeds.
So I think we have some people on our team who I think understand that stuff really well, and they're super awesome.
Yeah.
And so let's let's dig into personality disorder. So can you start by just telling us what is a personality disorder?
Yeah. Well, it's complicated, and even when I explain this to students, I will tell them and hope that they believe me that me describing a personality disorder, and even having gone through a few courses studying personality disorders and other disorders, they're not really going to get it until you actually know the academic side, the research, DSM criteria, and hear it from an expert and hear all of the vignettes, but also experiencing the individual. If you out there have had someone in your life close to you, or you are someone that has a personality disorder or things that you do, then you have a much greater chance of understanding. But if you don't have someone to reference, or you haven't experienced it yourself, even if you think you get it, I'm just speaking from my own personal experience. It's hard to grasp. But the easiest way I can describe it is that it is a disorder in perception. And I don't usually hear it described this way, but which makes me wonder if I'm off base in some way. But I find that all personality disorders, aside from antisocial, which is kind of an anomaly depending on how you look at it, but all the other personality disorders have pathologically distorted perceptions. Like a common personality disorder that people might know about is borderline. And so with this personality disorder, the distorted perception is that people are about to abandon me at any given moment, even when they're not. So it's not delusional, it's not hallucinating, it's not psychotic, but it's borderline psychotic, which is why it has that name, in that the individual is convinced of abandonment and reacts accordingly, even when there's no evidence of that or extremely limited evidence, like someone doesn't text you back right away and you are triggered and you become convinced. With other personality disorders, it's a different core pathological perceptual distortion related to the relational traumas that were chronic in early childhood.
Okay.
So that's the shortest way I can describe personality disorders.
Sure. What happens in avoidant personality disorder?
Yeah. So I always find that with any personality disorder, just for my own sake, I will understand it through its hypothesized and frequently found early relational trauma. And then once you understand that, then to me, it all kind of fits together. Because like, again, with like borderline, if you just read the criteria, it looks kind of like a jumble of behavioral observations. But when you understand that it all generates from an abandonment trauma, then it's like, oh, okay. So with avoidant personality disorder, the childhood trauma is that on, baseline is, and really this is true for all personality disorders, is there's general abuse and neglect that is present and lack of attunement. So the child, because, all children go through bad things and have bad moments, but if they don't have someone to turn to that is safe, that can listen to them, attune to them, and help them, then they're left to their own devices to come up with their own defenses against that fear and danger and threat. And that's similar, and that's the same with avoidant personality disorder, is that there's some sort of neglect and abuse. Often it's neglect, but the second feature of the childhood ongoing relational trauma is that the child is made to feel excessively afraid of social situations, which of course makes sense, right? But this can look a lot of different ways, right? It can look some obvious ways where you have a child who is, and it can be subtle. You can have parents who, maybe there's conflict, there's divorce, maybe the parents aren't the best parents in the world, but you don't characterize your parents as the worst, but they're not really there for you. And when you were 2 years old and you had a pain or a fear or a boredom or a joy, your parents just weren't there. Maybe they were avoidant themselves. Maybe they were depressed. Maybe they were working too much. Maybe your family was experiencing war trauma or something. But anyway, so there's some sort of neglect. And then the parents are trying to get you to go to daycare or to preschool, and they push you into it, and they don't have a good approach to it. And your experience in that preschool or in that daycare was not pleasant. And when you get, and that's very common, but then when the child comes home or gets picked up by the parents again don't attune, and they don't listen, and they don't notice. And so the child learns that they're alone in the world and they cannot turn to other people, and that there's a constant threat of being humiliated and rejected. And it develops into this perceptual distortion, which brings it to a higher degree than social anxiety, because we have regular social anxiety.
Jump in for a second?
Please.
Yeah, so this is awesome.
Oh, thanks.
Love it. So I wanted, because you're covering a ton of good stuff, so I wanted to first of all make sure that I really understood this, because I have never heard personality disorders described in this way before.
Okay.
And I struggled a lot with learning about personality and personality disorders during residency training. So I'm going to just repeat back. So you said, so I think it's really interesting because when we look at like some personality disorders, when I look at something like, let's say BPD or something like that, there's more frank or overt abuse, right? So there's like a very high history of physical abuse or sexual abuse for people who develop borderline personality disorder. And the way that I think about personality disorders, I think about non-personality, or maybe we'll get to this in a little bit, but I think about personality disorders is very similar to what you're saying in terms of it shapes the way that your brain, your psychology, your mind, and your physiology develop. So when we're young, right, the concrete is still wet, and if we draw in it, it'll kind of solidify in that way. So based on your upbringing, kind of the way that you're shaped is the way that I think about a personality disorder. And perception is absolutely a huge part of that. And I think it's a beautiful way to just launch into everything. And so what we're talking about in avoidant personality disorder is not so much frank abuse, but more neglect. And
Right, typically.
this is also why I think it's hard for people to recognize that, right? Because it feels normal to them. And we hear stories of things like physical abuse or sexual abuse. And some people will be thinking about their childhood and they were like, none of that happened. So they think that they don't even realize that there is a developmental trauma or neglect or something that could have shaped you in a certain way. It just feels really normal to them because the red flags that they have heard about don't apply to them.
Exactly.
And then I thought it was super cool how you described this like made to feel afraid of social situations, because then the question in my mind was, what does that look like? But I loved your kind of 1-2 punch, forced into daycare. And then when daycare is bad, you get bullied, whatever. And then when they pick you up, that forced into a social situation plus the neglect or absent parent is really what I like clicked for me.
Yeah.
Right. So when you come home and you tell your parents, hey, I don't like daycare. And then they're like not paying attention. And it's really interesting because I can think about the patients that I've worked with. And the ones that are okay are the ones that only have one of those two things. So if you get forced into daycare, but you have supportive parents when you come home, you'll be okay. And presumably. And then if you go to daycare and it's not traumatic, then you'll be okay. But when you have those two things, that's really what is the birth of avoidant personality disorder.
Yeah. Yeah, right. And you rinse and repeat that because you're anxious and then you're awkward and then you get shunned and then it gets worse and worse and worse, right? And then you develop this idea that you're inherently ridiculous for some reason. And there's no point in even trying because everyone knows that you're ridiculous. There's something deep down in your soul that makes you inherently rejectable in social situations that everyone can see. That's the perceptual distortion, is that everyone knows how ridiculous that I am, you know? There's no hiding it. So there's no point in even trying to hide it. And maybe no point in leaving my house.
So how does that cycle? Can you tell us a little bit about how someone goes from not having fun at daycare, and then you kind of alluded to this cycle that results in such a concrete belief about inherent rejectability that is impossible to hide, which I think also is just a brilliant way of describing it.
Yeah. Well, it's chronic, and even in the well-meaning parents that might even bring their kids to therapy, but if there isn't enough, so the cure, if you will, the treatment involves the correct. So I summarize in my mind all therapy into two prongs, which is awareness. So you have cognitive therapy and other kinds of discoveries about the self, so you can discover your triggers, you can manage things better in the moment. But the other prong is corrective experiences. And for people with avoidant personality disorder, awareness is important and can definitely help, but it won't take away the intense fear and the propensity to distort reality to fit the way things feel. So the corrective experience is to have social situations that go relatively well, and the individual habituates to that while they are being loved and attuned to. So that, commonly in my world can look like someone who has a spouse and a therapist with me who cares about them and is loyal to them and understands them and attunes to them and doesn't reject them and doesn't buy into their or doesn't slot into their perceptual distortion that they're going to be rejected and that they're ridiculous, and they venture off into what they believe to be risky social situations and do their deep breathing and reassure themselves, and it's a graduated exposure, and then they come back to me, they come back to their spouse, and they're welcomed back, sort of like the opposite of what happened when they came back from daycare, that kind of thing. And you rinse and repeat that enough times, and the neurology eventually habituates, and a new story and a new reality and a new perception, a new feeling is generated.
Okay, so that's cool. I'm wondering about. So there are a couple of assumptions that really worry me about that. So the first is that there's a spouse.
Yeah.
The second is that there's a therapist.
Yeah.
Because I imagine a lot of people with avoidant personality disorder have trouble engaging in romantic relationships.
Yeah.
Yeah.
Yes, they have trouble with the beginning because it's risky. But once they actually feel they can trust someone, which is a big leap, right? I mean, there's a lot of things you have to do to get there. Then they're actually, they revel in that, right? Then they're just, because it's not close. I mean, not all, but frequently people with avoidant personality disorder, if they have a family member or they manage to get in, through awkwardness, maybe they find someone who's also kind of awkward and they go down the road and bumble together, then there's not as much complications as there are with other, like with borderline, it's sort of the opposite. The closer you get to someone with borderline, like a spousal relationship, the more you're going to be distorted and transferred to. But yeah, I hate to say that treatment and change and alleviation of symptoms involves things that for some they don't have access to or will have a great difficulty overcoming the anxiety to get there. But that's the way that I see it, and that's how I've experienced things. It's a select sample size because I happen to have clients who are in that category, right? I don't treat people that I don't treat. So but it's the way that I see how we operate as human beings. We're perhaps the most social creature that's ever lived in the universe, and if we're going to develop these things socially, then we're going to get out of them socially.
Okay. So when you're working with someone who has avoidant personality disorder, you said at the beginning is hard, but then later on it becomes a little bit easier once you establish that trust and safety. Can you tell us a little bit about what that process looks like?
Well, everyone's so different, and as I'm talking, I'm referencing like a dozen people, and every one of them is different. And when I think about this course, the course of them, either in the past before I met them or during or after, how they managed to cultivate, for some people, they just they don't really associate spousal or romantic or sexual relationships with the risky social.
Interesting.
Yeah, they don't. It's like they might be okay with Tinder, but they're terrified of small talk with the grocery store clerk or introducing themselves at work when, over Zoom, and there's like, okay, everyone go around the room and introduce, but to even just walk up to someone on the street and introduce them, everyone's different is a thing. So it can kind of depend. Plus with romantic relationships, if someone pursues you, then you can kind of get over it. Plus you have this urge, from several angles in your body that might say, I don't care if this freaks me out, I'm going to do it anyway. So there's that. But, then I also will know people with avoidant personality disorder who have never had any romantic relationships and have given up on that ever happening and are absolutely terrified of things like Tinder. That'd be worse than talking. So, everyone has their own journey and associations. And it, to me, has to do with where their traumas came from. You know, if your social traumas came from acquaintances, or sometimes it's a waitress, like you're forced to order for yourself, and it's a spike in distress, and so for some people it's those kinds of interactions. Others, it would be like on the playground when you're flirting, or some other people come over on the playground and start wanting to talk with you, and that's more emulative of what a peer-to-peer romantic relationship. So everyone
Okay.
has a different, and usually what I find is that people, there's some in, like there's some oasis of comfort in, so and finding that is important, to capitalize on it, kind of pour all their in. For some people it's younger people, they like to be a daycare worker, and they don't have any nervousness around kids, that kind of thing.
Yeah, so it's interesting because it sounds like what I'm hearing you kind of say is that, so we have this experience early in childhood where, or not experience, several experiences, right? It's chronic for it to be a personality disorder. So
Yeah.
there's this pattern of forced social interaction followed by a lack of support.
Yeah.
And then,
Well, it'll feel forced to them. It can be forced, obviously, but they will feel pushed into it, like no, 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 and then it'll go horrible for them. Yeah.
okay, right. So, and then they develop a perceptual distortion.
Yeah.
But that perceptual distortion circuitry doesn't necessarily translate to things like romantic relationships, right? There are some situations or age differences. So like our brain is basically figured out what triggers this kind of cycle.
Yeah.
And
Yeah.
what,
Exactly. Yeah. For some, those traumas will be triggered. Those circuits will be triggered with the beginning of a romantic relationship, but for others it won't be. Yeah.
okay. And it's
And they won't be triggered necessarily if they have an established relationship with like a sibling or even a parent. Those relationships won't trigger them at all, and those people will say, if only the rest of the world knew you the way that I knew you, because I see you around other people and you're a completely different person, and when I'm with you, you're this, easygoing, funny, spontaneous individual, which isn't a common, which is common for people with avoidant personality disorder. They often will have one person. Now, sometimes they keep that person at arm's length, but I am more optimistic when I have a client who says, "Oh yeah, I feel comfortable around my dad, and we're really close, and we see each other every other day, and he's my guy." You know what I mean? And
Yeah.
so that we can capitalize on that.
Yeah. So I'm curious, can you give us so a couple of these examples are awesome. So like this sort of getting feedback of, oh, you're a completely different person around me. I see this version of you. What are some other things that you've seen or kind of common experiences, almost from a qualitative research or subjective experience? If someone has avoidant personality disorder, what is their experience of life? What does it look like or feel like?
Well, it can look a lot. So one angle that I've alluded to or described briefly is that they're convinced that everyone knows that they're ridiculous. It's a very common, whether they wouldn't necessarily frame it that way, but they, they might have a very common social anxiety that is, even that is extremely excessive. Like they have to plan for several hours before there's a meeting at work in which they might be asked to introduce themselves, and they are worrying about it and thinking about it, and at best, honestly, they're practicing in the mirror. This is what I'm going to say, But often people get so bogged down in the anxiety that they can't even do that, because imagining it and planning for it actually exposes them to the anxiety, which is overwhelming to them. So there's that. They will often choose jobs that don't require those kinds of random social interacting. But other people, I had a client once that was convinced that everyone knew that they dressed and walked weird, that as soon as they walked out of the house, that everyone would notice that they were incredibly unfashionable, like ridiculously, laughably goofy when they dressed, and also the way that they walked, just their gait, the way their arms would swing, they just would like. So they would do everything they could to, try to make sure that they were as unridiculous as possible, even though they knew that they were. But that would make them look a little weird because when they're thinking about every muscle movement as they're walking, it just kind of looks a little odd.
Yeah, awkward.
People probably don't care, you know what I mean? If they do notice, they're just like, oh, that guy, has a limp or whatever. But they're convinced, and then they see people kind of react occasionally because they are acting a little strange. They're like, see, everyone knows, and I should just go home and the foundation of this, which might differentiate it from social anxiety itself, is that the individual believes deep down that there's something inherently ridiculous and rejectable about them. There's a defect deep down that they only have, honestly. If they hear other people that will say similar things, they're like, well, yeah, but I really have that defect, and they just, because of the way they were treated, right? They were shunned and they went through these social anxieties. They developed an almost magical thought that there's something inherently defective about them, and then they find something in society to latch onto, like fashion, like the way their face is, or like the way they swing their arms, or like the way that they talk, or whatever, or how good looking they are. And that helps them to feel like, well, at least there's some concrete reason why I feel the way I do. But if we strip away and we combat that, in therapy, cognitive therapy and narrative therapy and stuff, and we strip away that and we're like, no, empirically, all these people are saying that's not how they see you. They're still left with the knowledge. They know that they're defective and rejectable. There's something wrong with them. Maybe it's not what I originally thought it was, like my fashion, but I still know. And so that's where the corrective experiences come in, where they can actually go through enough experiences to create new neurology, new circuits that show them otherwise.
Yeah, so that's so interesting. It almost reminds me of when I was learning about schizophrenia, and understanding that the basic problem there is a hyperactive pattern recognition in the brain. So what happens is people will have this feeling that they are being watched. And then what happens is once they have the feeling that they're being watched, then they start to interpret the world around them. And this is why people who are like paranoid or delusional will believe that the FBI or mafia is following them. It's really interesting. It's not that they have direct data. It's that they, first of all, I feel like I'm being watched. And then they notice this person is sitting in a car across the street. They notice that when they go into a gas station, there's someone who has a blue hat on. And then the next time they go to a gas station, there's someone else with a blue hat. Is this some kind of uniform? So the part of our brain that generates patterns is hyperactive. And then what happens is their intelligence, their analytical capability kicks in and asks themselves the question, who is it that has the resources to deploy all of these people and follow me around? It must be the FBI. It must be the mafia. It has to be some sort of, worldwide organization, Illuminati kind of thing, because who else could pull this off?
Right. Yeah. And we all do this, right?
Yeah.
Our feelings are first, and then we fit reality to our feelings. None of us are not like that, if that's a sentence.
Yeah, absolutely. Can you tell us a little bit more about that? Because I don't think many people understand that.
A common experience is if you are dealing with the other side of the aisle politically, and you're thinking, how did you come to that conclusion that's divorced from the facts? And they're looking at you in a similar way, depending. And that's, I think a lot of people will conclude, well, it's motivated reasoning, it's confirmation bias, and that's all just manifestations of this is the way it feels, and so I'm conforming reality, or I'm cherry picking reality to justify the way that it feels. This feels scary, or I've been convinced of that. And research shows that, that if you've been through trauma, then you're more likely to believe in a conspiracy theory, right? You're more likely going to believe that there's a powerful force that is conspiring against you, because that was actually true when you were 3. There was a powerful force conspiring against you. And we all, and I do this all day long, and it's probably helpful in a lot of ways, right? Like, if I believe that my 2 dogs love me, but I can't confirm that, I'm going to look for, the dog comes to me when she's scared of fireworks. That means she loves me. It helps me to sleep better at night.
Yeah, so it's I think it's interesting because you're mentioning a couple of things that I kind of want to highlight. So the first is, when we're talking about avoidant PD, one thing that I thought was really cool was your people seem to do a lot of mind reading, right? So if you are convinced that you know what is in someone else's mind when they look at you, I'm sure that this person thinks that I look like an idiot. That's one really powerful feature of it, right? When you because you don't know what's in someone else's mind, but something is telling, you believe that you know what's in other people's heads. The other thing is the uniqueness of it, that one person potentially with avoidant personality disorder can look at someone else and say, you are ridiculous for believing that. But I'm sure that I'm fundamentally flawed. And so the third thing that I thought was really interesting is that the way that you almost described how they latch on to a particular defect, but the defect is deep rooted. And then they try to find some reasoning for it, because honestly, and that's almost seems a little bit protective to me, because at least if I have an explanation, if I feel horribly broken and I can blame my awkward fashion sense for it, that almost is protective, because then I know why I'm broken, and it's not this raw feeling of unbrokenness. It gives you some sense that, okay, if I could fix this one day, and I know they don't try to because they feel like nothing ever works, or maybe they try and they just feel like it never works because that's not actually the problem. But I think it's really interesting how, so when you're working with people, do you as you strip away those distortions, what happens to that raw feeling underneath?
Yeah. And by the way, it's brilliant of you to make that connection. I actually had never thought about that before, that it would be almost like a defense. It's almost better to think it is fashion than it is something deep to my core. So at least in the conscious mind, it's a temporary reprieve from what they believe to be true because of the mistreatment they went through growing up. Yeah, when people have those defenses or surface level conclusions stripped away, it can actually be worse for them. It can feel raw and hopeless, like as you're saying. At least with fashion, there's a chance, right? But if it's just you, then there is no chance, right? And that's where depth therapy actually helps, a deep relationship with the therapist, so that because it'd be tempting if you're a friend or a family member to just say, don't do that to yourself, you're a good person, and to try to reassure the person, right? And maybe that would temporarily help, but that's not going to take it away. A trained specialist would understand, okay, we've arrived at something that will take potentially a few years of corrective experiences and hard work to actually chip away at. And here we are, and it's okay. And I'm thinking of a few moments in my mind, and it can be scary for me too. I'm a human being, and I don't want someone to feel that way about themselves, and it'll break my heart. And I'll absorb their anxiety about having to look into the abyss. But when I'm at my best, I'm like, it feels like an abyss, but it's not an abyss. And it feels like an emergency, but it's not an emergency. In fact, the fact that it feels like an emergency means we've worked hard to get to this place, which is a very necessary place. And this is the same with all personality disorders. there's a moment of looking into the abyss and having that fear. It can happen in the first session, but it can also happen in like the 100th. But the trick is that you, at the very least, as a therapist, have to believe that it's not an abyss, that there are things down there. There is a self there. There is safety in the unknown. And we just have to, search around in the dark or start turning up the dimmer switch, but, to see it. I don't know if I'm making any sense. But when it comes to avoidant personality disorder, that looking into the defect, the inherent defective self, and for me to say, I'm glad that we're here. I'm sorry that you feel this way. But the fact that we're here means that we have gotten to a certain phase, and it sucks and it hurts and it's scary and it's the worst. And, I'm in it with you, and we'll go through this together. But know that I know that you're not defective. Know that I know that there's nothing wrong with you. And know that I know that you were told that and treated in a way that was like that to convince your 2-year-old self that that was true. But know that I know that that was not true.
Yeah, it's so interesting. And I think you made a lot of sense for people who have been there. I love this concept of looking into the abyss. Because when I work with, it's so interesting because you said, antisocial personality disorder is a little bit different. Mm-hmm. And so I work primarily with cluster B personality disorders.
Yeah.
And I just think they're more fun.
Well, they're more likely to come into therapy, that's for sure.
And so the interesting thing is when I work with people who are sociopaths, we look into the abyss, and I love the way you describe it because I think every patient that I've worked with has this experience of looking into the abyss. There's one moment where we look into that. Interesting is with people who are sociopaths, we say, I say, there is an abyss there. I see it, you see it, and it's okay. What are we going to do about it? Right. So I think their emotional architecture is also a little bit different to where that's not quite as scary to them. Mm-hmm. But it's so I think you described it well. And I think this is the hard part for a lot of people is that the deeper we get into describing what happens in therapy, the less words work.
Yeah.
Right. So you just have this moment where everything is kind of laid bare and it is super scary. And I think what you're really describing is that's really healing about that is that in that moment, they're not alone. Mm-hmm. Right? So when you look into and see the worst parts of yourself, there's someone there who doesn't reject you. Mm-hmm. And even if you say, hey, I think it's just feelings, and they're like, no, it's reality. I think the beautiful thing, and this is what little clinical experience I have, is that in that moment, what they believe or don't believe is not nearly as powerful as you being there with them. Mm-hmm. And then also, so what time next week?
Mm-hmm. Yeah.
Right.
Yeah. And that's, that's the magic, right? That's the formula is consistency and being with someone, and the client puts their hope in you because you have hope, because it's too much to expect a client to have hope about that. It's too overwhelmingly convincing to them in the specifics of avoidant personality that the individual is defective and ridiculous, but they are convinced enough that you're convinced and you are an expert. So maybe there is hope. My therapist has hope. I'm choosing to go along with that. I'm taking the leap, but
yeah,
and that's hard to do, because you can just say as a therapist, I have hope, but you have to be, connected on a deep level with the client, and the client has to be convinced of that. You can't just do this from the sideline. You got to get in to the scrum of it,
So I think when you say take the leap, I think that's where the neuroplasticity happens, right? So before you take the leap, you know everything. Your logical mind is fixed. You have all of the answers. So if you really think about it, that confidence in your beliefs is what that's not neuroplasticity. When you take the belief, when you take a leap into the unknown, that creates a question mark from a psychological perspective. And what I've kind of seen is that's what really triggers the change, is being able to take that leap. And then that's the moment that, like you're saying, you start to question. And when you start to question your beliefs, that's when the brain starts to change, the mind starts to change. I'm kind of curious.
Was it? I mean, you would know more than I would, but isn't that one of the theories as to why SSRIs work? Is that it doesn't make you happy, but it makes your brain more plastic. It makes your brain more flexible to change in those moments.
It is absolutely one of the theories.
Yeah.
But I think that the tricky thing about SSRIs is that for most psychiatric medication, we're not too clear how it works.
Right.
So I think there's absolutely some evidence of neuroplasticity induced through SSRIs, but the mechanism of that is also like questionable. So, people who are very anti-SSRI basically will even acknowledge that the one thing that an SSRI does is emotional numbing. So, and it doesn't make you happy. It just potentially makes you less sad. And what I would say is the mechanism that I would kind of lean into there is if you look at emotional numbing, then I feel less sad. And what are we talking about? We're talking about when an emotion is very, very strong, you are more convinced, right? So when I'm super, super depressed, it's not depression, it's reality.
Right.
And so if we quiet the emotion, then it opens the door for more cognitive flexibility. And that's evolutionary, right? So if we think about why have emotions evolved, they've evolved to short circuit analysis. If I slap you across the face, your analytical mind is not going to be like, I wonder what he's going through today.
What's the ethics of slapping people across the face? I wonder what Plato would say. No, you need to just react. Yeah.
Maybe if I, yeah. So I think it's interesting. So I think that's one mechanism of potentially neuroplasticity. The really interesting thing is if we look at, I think there are more robust studies on, maybe not more robust, but if we look at the mechanism of action of a lot of these like pilot studies on psychedelics, neuroplasticity is a huge part of it. A lot of the meditation literature is about neuroplasticity. And so I think we absolutely see that as a goal. The really interesting thing is that even if we look at psychedelics and meditation, we just did a stream about this recently, and what's interesting is it just induces neuroplasticity. What you do with the neuroplasticity is up to you. So one of the really scary things that I've seen is when people hear psychedelics are healing, they'll be suicidal and depressed, and they'll take psychedelics with the hope that it heals them. But all it does is induces change in the brain. And if you're in a negative environment, you can actually end up way worse. So I've seen a ton of patients who have anxiety disorders, PTSD from bad trips. And if you look at psychedelic-assisted psychotherapy or the religious traditions, what you tend to find is that when they use these neuroplasticity-inducing agents, you have a guide like a shaman or a guru or a therapist who helps you then integrate that experience and make sense of it in a much more positive way. That's probably what's responsible for the healing. And like what we're describing is, when you're in that moment of staring into the abyss and they take the leap of faith, you're in the room with them. And if they do it on their own, it can be way too scary.
Yeah. I feel like I just took psychedelics and my mind is blown. That's interesting how all those connections. Yeah, I'm going to have to chew on that for a while, but I like it.
Yeah, so maybe a conversation for a different day after you've had a chance to chew. And I was wondering if we can kind of switch gears a little bit for a second.
Sure.
So tell me a little bit about the difference between social anxiety and avoidant personality disorder.
Yeah, well, I'll tell you that if it's fairly severe social anxiety, but not beyond the fuzzy threshold into a personality disorder, you present that case and give each clinician a good amount of time to assess, maybe 5 sessions. You're going to get varying diagnoses, some saying it's just high-level social anxiety and some saying it's low-level avoidant personality disorder. But a common differentiating factor with a heavy asterisk is that people with social anxiety tend to know that they have excessive anxiety without treatment. They tend to understand, yeah, I, I have this phobia of meetings or of social situations, and it's all in my head. I get up in my head, and I'm convinced that everyone, and I know that they're not, but in the moment I get stressed out. So when they're relaxed, they often, but that's the thing, is a heavy asterisk, because some people with what we would call social anxiety don't have insight into it, or have pockets of lack of insight, meaning that they are convinced that people are thinking negative things about them when they're not, or that they're inherently ridiculous when they're not. But that's generally the demarcation line, is, for me anyway, it's the pre-treatment, pre-awareness, the extent to the semi-delusional perceptual distortion. How convinced are they of the fear when they are calm, and how severe is it? And sometimes it's very obvious, right? If someone is absolutely convinced that they are the most disgustingly ugly person on the planet, and as one human in the culture, I'm looking at them and saying, I mean, maybe you're a 6 out of 10. I don't know, but you're definitely, and even if you were a 1, I can't imagine, what are we talking about here? Like you're just this H.P. Lovecraft, like unnamed spaghetti monster face or something. I don't even know. Like, what do you, like, that's the image. So that would definitely differentiate it from social anxiety, right? But not everyone has that kind of obvious perceptual distortion that they latch onto. So I, in practice, don't really differentiate between the two. The treatment is essentially the same. If someone's in the middle zone, it doesn't really matter what label we put to it. It's similar with borderline. If someone is, on the moderate end of the scale, or moderate middle of the scale, and another clinician might say that they are sub-threshold and just have traits, or have severe preoccupied attachment or something, it doesn't really matter. The treatment's the same.
Okay, interesting. So a couple of things that I'm taking away. One is that, so how do you know you have avoidant personality disorder? If you look into the abyss and there is a Cthulhu-esque monster there that makes you not human, fundamentally not human, right?
Yeah,
You are a Cthulhu-esque monster wrapped in a human form.
Yeah.
And
everyone sees it.
And everyone's going to see it, which is why you have to avoid them, and you have to go out to a cabin in Massachusetts, which is, what happened with H.P. Lovecraft. And so that it's such a great characterization. And I also really like this kind of, and fair point, that these diagnoses are essentially artificial distinctions that we make, right?
Yeah.
And that the underlying pathology is all along a continuum.
Yeah, because people with social anxiety often have a similar background, a similar trauma,
Yeah.
a similar path. Yeah.
So, and I'd say what I kind of heard there, which is sort of squeezing it through my understanding of the difference between the two, it is actually kind of the degree of pervasiveness to it, right? So if you have a psychological architecture that develops at least somewhat in a healthy manner, and then social anxiety happens to you later. So I think that, diagnosis really starts to spike around puberty, for example. So you can have a relatively normal childhood, but also heavy asterisk there that you probably had some of these experiences which make you somewhat vulnerable. And then, so since you have that normal personality architecture develop, then social anxiety sets in, which is what allows you to see and have some degree of insight when you are calm. Because like, hold on a second, like, I wasn't that way when I was 8. Something's changed. Like, now I recognize that I'm not, I have friends. I'm able to see that at times. And then depending on the physiology stress level, depending on what's going on in your amygdala and things like that, you can lose that insight. But it's essentially the way that I kind of conceptualize it, or the way I teach it is, personality disorders are about the way that you're shaped. And then usually what we used to call kind of Axis 1 diagnoses back in the day, right? These are things that happen to you. So you developed relatively normally, and then something happens. But I completely makes sense that there's a shared experience and there's a fuzzy line in the middle.
Yeah.
And that from a clinical perspective, the treatment is the same. So
Right.
And so
Yeah. Right. That's all. Yeah. That's just another way of saying the way that I see it. Absolutely. The pervasiveness and the structure of personality that for people without a personality disorder, with just social anxiety, and just social anxiety can be crippling, by the way. It can be really, really debilitating. That the individual baseline has, what some literature will call an intact personality, or their reality checks are stronger, their ego strength is stronger, that kind of stuff. But I will say that you can have what we would call social anxiety and feel pretty confident as a diagnosis, and also have a personality disorder. You probably wouldn't see someone diagnosing someone with social anxiety and avoidant personality disorder, but you could have social anxiety and, say, borderline personality disorder,
Sure.
or some other personality disorder. So it gets a little weird. But yeah, what you're saying in the beginning is, these are constructs. These are things that we in psychology and psychiatry construct as a way of conceptualizing behavioral clumps and experiences so that we can research and guide treatment. And it tends to pan out. These labels have been around for over 100 years, or at least the concepts have. Maybe the exact wording of the label has changed over time, but the construct of avoidant personality disorder and other personality disorders have been around for a long time, because there's just been a lot of observation of humans that seem to fit into this category.
Yeah. So speaking of kind of long time and changes over time, so what's your take on the rise in technology and how that affects social anxiety or avoidant personality disorder?
Well, on one hand, it has been helpful because subreddits will provide these extremely quick SEO found forums and communities where people are, generally speaking, healthy and speaking openly. And I, as a clinician, will sometimes read these subreddits just to remind me of the variance within a particular personality disorder. I, have to filter, and I can't. I am always a little skeptical of people self-diagnosing, of course. So I'm always reading a post and thinking, okay, where's the marker so that I can be assured that this person actually does have this disorder? And I would say half the time I'm not satisfied in that way. And, it makes sense, because the landscape would be hard for people to discover. But at the very least, I think the internet has really helped. You and I are on the internet right now talking to people who might have never even heard of a personality disorder prior. And, we see the evidence of that. The problematic tip of the iceberg is that people are labeling everyone a narcissist these days and gaslighting and stuff. And we can lament that, but that's the result of having worked for decades in our field to raise awareness about abuse and about personality disorders, and moving away from just in the idea of inherent spiritual badness. So we see some ill effects, which I didn't predict, but well, how was I supposed to know? But overall, you have a lot more people going to therapy, and you have people tuning into this live stream who 30 years ago would have thought, well, that's for crazy people. Why would they want to watch two clinicians talk? So there's a lot of good things. The bad thing is that it can inadvertently create a platform upon which individuals lack the exposure that typically will occur naturally when you have nothing to do at home. Like when I was a kid in the 70s, there wasn't anything to do. There was 3 TV channels, and none of the programming was geared towards kids. So aside from before school and maybe an hour after school, and you just were bored out of your mind, and toys weren't as prevalent. There weren't as many cheaply made, readily available things to play with. Certainly also video games. And so you either had to read, draw, or climb trees with your friends, and that's what I did. And so with the internet and with media, you have a lot of young people and old people, adults who, there's several Y's in the road, and if there was no internet, there was no technology, there were no video games, they would say like, oh, okay, fine. I'll go knock on the door of my neighbor and see if they want to play or something like that. And then you just, you go through the normal exposure and habituation and trials and tribulations, and hopefully, not always, but you progress through that experience, learning that things are going to work out in the end, and bad things will happen, but overall you'll get through it. And because the other people depend on you, because they don't have video games either, so if they don't want to shun you because they don't want to be alone, they don't want to be without. So I'm not saying anything mind-blowing right now, but I think that we see that, and that seems to be the consensus, is that there's a lot of things conspiring for isolation. Helicopter parenting is another factor, I think, that people identify.
Yeah. So it sounds like you're kind of, and that's been my experience too, that I think when I was growing up in the 80s and 90s, when you got bullied, when things were socially difficult, you kind of didn't have a choice, right? So you were kind of tossed into the deep end, and it's like sink or swim. And so it was a really brutal. I had a really rough period of time between probably 5th grade and 8th grade, and it was like, you just had to learn. There's no retreating to anywhere.
What happened?
I was bullied very heavily.
Oh, really?
Yeah.
Oh, ouch.
Yeah, it made me who I am today.
Right.
So
have you found them? Have you looked them up and given them the finger and said, "Look at me now, MFers"?
Not really. Yeah.
Do you want to?
I used to want to, but
I want to. I want to find these guys and tell them, "Look at him."
You find the people that bullied me?
Yeah.
Why?
I can see you as a 5th grader. I don't know what happened, but I can visualize it. And to think that people would mistreat anyone, but, mistreat you, which I imagine, if your demeanor is similar in the 5th grade as it is now, that it's, curious, smart, active, a talker, but not harmful and not, problematic, not worthy of being targeted, and to think that there would be people that would habitually, target you and harm you is upsetting to me. It makes me angry. It makes me want to go to those people and say, I don't know. I don't know what I would do, but it just, I guess I want a time machine and go back and like alert adults when you were in the 5th grade to tell them to protect you or something. I don't know. I just have that urge.
Yeah. So I appreciate this is great, dude. I'm loving this because, oftentimes what we do on stream is I do what you're doing.
Yeah.
And it's fun. This is the first time I've been on the receiving end, and it's quite the experience. So thank you so much. And
I apologize if it's like invasive or
no, I maybe I was caught off guard because I wasn't expecting it. But my first, the thought that popped into my head is like, well, I do this shit to people all the time. So like, so, and I think it's important to do, right? So I think it's important to acknowledge. I think for me personally, like, I think a lot of that, I used to sort of feel that way. And I remember I had one experience where I went back to my hometown and I ran into one of my bullies. at a bar, actually.
Mm.
And it was sort of, at first I felt a little bit triumphant, and then I sort of like realized, so like I have a history of kind of spiritual practice, and I think a lot of that stuff has to do with the ego. So like, you know, wanting vengeance on people is like a gratification of the ego. Is it sad? Was that kid hurt? Sure. Yes, absolutely. And at the same time, part of my post-traumatic growth and part of my narrative and part of the work that I've done is like to really stop and think about that, right? So just because it was sad for that kid, that this is part of the experience of life, that negative things happen to us. I happen to believe that that's my karma. So did I do anything to deserve it? Maybe not in this life. But that all things, there's an order to things, and that also those experiences make me part of who I am today. And this is pretty post-traumatic growth kind of, you know, narrative rebuilding and all that good stuff. But like, I really do believe that. And so now I try really hard to not hold ill will towards them, because they too were just kids, right? Like, I mean, a fifth grader, they don't know what they're doing. They're, you know, so it's like, what's the point of, you know, going back and telling them? I mean, there can be some gratification. There can be a sense of justice. There can be a giving in to anger. But I generally have the attitude of, like, what's the point? Like, I'm on this earth for who knows how many more years. Like, do I want to spend any iota of energy going back and feeling triumphant? Like, there's like more important things to do.
Yeah.
So
sure. Well, the litmus test would be, and I will ask this as generally as possible, but you and I are on the internet and will experience occasional groups of people that are coming after us, you know? And the litmus test, I guess, would be that as you and I go through this, are we having understandable and within normal limits reactivity to that? It's hard to deal with regardless, but if we are unresolved or still, you know, processing these feelings of past bullying, then I guess we would see symptoms of overreactivity.
Or underreactivity.
Yeah.
Right.
Yeah.
So
I just reviewed something. But it's interesting. I have a very similar experience. I wasn't bullied, generally speaking. I was a big kid. I actually was one of those kids that would walk around trying to act like I was shorter because I felt so awkward because I was so tall, you know, and so big. And, you know, it was the 70s and 80s, and because I'm Asian, everyone assumed I knew karate and I could kill them, you know, or something, because I grew up in a mainly white community. And so there was that worked for me, which kind of meant that I never really learned how to fight well because no one would ever fight me. But anyway, I was in like 7th grade, and I'm walking home, and it's, you know, the Pacific Northwest in Seattle, and it's kind of cold in the winter. And as was the fashion at the time, you didn't wear socks, so my feet were basically numb. And this bully, this older guy, I had no idea who he was. Him and his friend are walking right towards me as I'm walking home from school, and he walks up to me, and he just stomps on my foot as hard as he can and pushes me down. And
oh my God,
I'm just like flabbergasted. I'm like, what is happening? Did I do something? Did he mistake? And he just continued walking. You know, looking back, it's obviously, you know, likely that this guy had something going on in his life, maybe some home life problems, who knows? But I got home, and I just peeled my big toenail off my foot. It still isn't quite attached to my body, because, you know, once that comes detached, it doesn't really reattach very well. So if I want to, I can like trim that nail. Anyway, it's gross. But I ran into him in my adult life in a bar as well, and he was with all of his friends that I recognize, you know, older people from my school. And I had a couple beers, and I'm just like, I'm gonna go confront this guy. You know, I'm gonna go get him, because he took me by surprise. we're the same size now, or I'm bigger than him, and so this is going to happen. So I go up to him, and I kind of get in his face, and I'm just like, "Do you remember me?" And he's like, at least he's saying he doesn't remember me. And I say, "Well," and I tell him what he did, and he just sort of looked down at his feet, and all of his friends looked at him and said, "Did you do that? Did you do that to him? Why would you do that to him?" And he just looked ashamed, and it took all the wind out of my sails. And I just said, well, yeah, maybe don't do that or something." And then I just walked away. But it was similar to you. I was just like, "Oh, you're not this big monster. You're just a regular struggling human like anyone else." And it's not the same like it was back then. And it just completely, before that was a time when I wasn't a therapist and wasn't trained. And so I didn't have the perspective that I do now. So, planted this seed that would later grow to this idea of just like people who we might look up to as monsters or as, these evil creatures are more likely they are struggling and ashamed, and it manifests in this hostile, harmful, possibly bullying behavior, So I don't know. I think we're off topic, but
no, I think this is great. So if I can respond.
Yeah, please.
So the first thing is like, it's super scary how senseless and random that is.
Yeah.
Right. So like, I'm kind of thinking about just because I think in some ways, not to get too comparative here, but I'm thinking about my own experiences and how sort of reassuring the certainty of the bullying was, right? So it was like every day, but like I knew what I was getting. So like I kind of knew where the danger zones were. So there was like safety and there was danger, but that was at least clear, if that kind of makes sense, right? So there are like
if
some
you
people
followed rules, you wouldn't get bullied.
No. I mean, but I know that. Well, so not like the rules at school, but like I knew how to become invisible. I knew that PE was going to be rough. I knew that if we played dodgeball, like that was good because my only job is to dodge things, which when people throw things at you a lot, like you get pretty good at, right?
Okay.
So, and when I'm hearing your story, it almost like seems kind of like more frightening to me because it's like random and senseless, right? So you're like walking down the street and you're living your life and the world is like a safe place.
I was actually walking my girlfriend home, which is another detail.
Right. So and now there's like this aspect of like humiliation involved. Yeah. Right. Yeah. So you're made to feel so much less than, and there you are with your sockless shoes in order to be fashionable and cool and your feet are numb, right? And then also like I mean, it's like, I don't know how to say this, the deepness of the lingering physical representation, right? Like that wound, like you literally carry it with you.
Yeah.
And it's, by your words, gross. So like there's something like about that and now it also makes a lot more sense, right? So like your angry reaction is like, okay, so you're like, this kid doesn't deserve this. I want to go back and like protect him. And I felt very cared for in that moment. I felt really emotional. My palms became sweaty, right? Yeah. And it's like, I just met you. And your ability to see into that and care for me in such a profound way. And now what I'm understanding is like, it's not just me, right? It's also protecting you. Mm-hmm. And sort of the sense of injustice and how, and that's probably also why both of us are on the internet, because we also recognize that there are a lot of people out there who don't have people advocating for them, right? People with avoidant personality disorder who get shoved into situations and then no one is there to attune them. Yeah. And so even this whole exercise in this moment, in this conversation is all a very, very distal manifestation of trauma and the work that we now do and how it gets shaped into people and all that other good stuff. So I don't think it's off topic at all. I think it's off topic, but it's not. I think this is what we're here to do.
Yeah. Yeah. I mean, it's 2 hours of live streaming. You got to keep the needle moving somehow. So might as well just talk about ourselves narcissistically. But yeah, no, I feel really cared for too. You have that ability to hear and reflect and make, I feel seen, I feel understood, I feel like you care, and that you were absorbing,
Yeah.
I didn't expect that to happen during today's live stream.
Me either. And I think that's what blew my mind about this, and I'm really grateful, is like how, you can do this. Like we do this every day.
Yeah.
And even if you're an expert in it, how well it works. So when you do this to me, when you care for me, like I know exactly what's going on. My analytical mind is like, well, I didn't know exactly what was going on. I was caught off guard. And then as you shared your story, I was like, oh, this is interesting, right? But it doesn't matter whether you know how the magic trick is done. The magic still works. And
yeah, right. Because it's not really magic. I mean, I know your meaning, but it's sort of like being an art critic or something. You still look at art and go, wow, that's some amazing art. It's working on me. It's the same. Love and support and expression and understanding and connection. This is real. Or a cook who's like understands how everything is made, but they could still
eat some. I love that analogy. Yeah.
Yeah.
Anyway, if I can circle back a little bit,
please.
So I think we're gonna have to figure out what just happened here. I think is very significant, and I think I don't know what to do with that, but I also want to honor what we're the work we're here to do and make sure we have enough time for that.
Absolutely.
But thank you for this quick tangent. And I have no idea how chat is going to be responding to this or what they picked up or whatever. I'm so curious about that, right? So
I thought you were watching. I thought you were
monitoring the chat. So I tune in 100% when I'm talking to a human being. I really just completely ignore numbers and
we're flying without a net now.
Yeah, absolutely. And I think because even if my attention is a little bit fractured, I think it changes the empathic resonance.
Yeah.
But we'll check in with them. I'm so curious. But kind of going back to this, so I was hoping we could talk a little bit about schizoid versus avoidant personality disorder, and if you could talk to us about schizoid.
Yeah.
Because I want to say I've seen maybe 3 patients out of 5,000, 6,000, 7,000 that I've seen in my career that have schizoid personality disorder.
Yeah. I've seen an increase, I think, because of the internet and because of the crisis of loneliness and because of the destigmatization of therapy, and that therapy can now be sought out on the internet over Zoom or over video conference, and that is less of a risk for people to take. It's much easier to just click on connect than it is to drive across town and park and da. So there's I think anecdotally been an increase, but to speak to the same language that we were using with avoidant personality disorder or the same format, I'll start with the original trauma as I see it. And this is related to research. I'm not just completely flying blind here, but it's hard to research this sort of thing because you're asking people to retrospectively self-report what their childhood was like. We, for good reasons, don't have the ethical, leeway to take 1,000 kids and take 500 of them and treat them in the way that we think will produce schizoid, and take the other 500 and not do that and see what happens. We can't do that. So we have to, hear stories and develop models. And so this is an integrative model for me, is that with the childhood neglect, the childhood trauma is that of neglect mainly. So with avoidant personality disorder, it's definitely on the neglect side, but it can also have classic abuse, positive action, harm to children. But with schizoid, it's almost always, significant neglect. They can be abused too, but definitely hands off. And schizoid people will report that when they were young, they were left to their own devices at best, and at worst, they were just actively shunned, or sometimes even schizoid people will say that they were treated like an object, like a pet. Like they would be, like one story was that they were carted around to friends and family like they were so cute, or they could do this trick or something. And they felt special when their parent was carting them around. But as soon as they got home, they were just completely ignored and rejected. And they were like, oh, I'm just like a plaything, like a toy, or an automaton, which is something that schizoid people can sometimes start to believe, that they aren't really human, that they're a shell of something, because that's the way they're being treated. So the other element is that they're very commonly, with this trauma of being neglected severely, is enmeshment or invasive enmeshment, meaning lack of boundaries between the parents somehow. Like a classic example of this, which is a minority of reports, of experiences, is that the parent will suddenly and aggressively and traumatically invade the child's bedroom and accuse the child of hiding something, whether it's food or pornography or a diary. You secretly are writing stuff about me, and you're going to, so it can manifest a lot of different ways. But there's this idea of just like, at any moment, I can be invaded if I don't protect myself somehow. So what the child learns early in life is that they don't have personal boundaries, and no one cares. No one's there for me. And so they have a lot of motivation to attenuate their mindfulness and their noticing of their own emotions, which has to do with noticing your own physical sensations. And so they will start to actively turn away from their emotions as a way of like, well, no one cares about my emotions. So if I don't feel my emotions and I don't notice my emotions, then I won't have to signal my emotions and be rejected. The other thing is that they're worried about being invaded. So if they were to accidentally reveal what they are thinking and feeling, then that gives that invasive person the ability to get them, that it opens the door a little bit so that the invasive person might, rush in and invade and control and harm. And so the child learns, I have to get rid of my emotions, and this is mostly unconscious, and I have to turn away from people. So they will isolate themselves, and they will believe, for the most part, and this is a pretty heavy asterisk on that, is that people with schizoid actually consciously think that they don't want relationships, but actually they do. And this is what really differentiates schizoid from the other isolated, lonely personality disorders like schizotypal or something, that with schizoid people, pre-treatment, pre-awareness, they will think that they actually don't want attachments and don't want connections, but they actually do. And there's a lot of theory here and a lot of research, and there's different consensi, if you will. But the general consensus is that people with schizoid deep down do have the normal amount of desire for connection and relationships, but they are defending against it, because to feel that and to acknowledge that opens them up to being terribly disappointed and neglected and possibly harmed by other people. So the adult lifestyle of someone with schizoid personality is that they are alone. They think that they are happy, but all of their emotions are subdued. They think of themselves as not having emotions. They will often think of themselves as being, quote unquote, sociopaths or psychopathic, because that's the first thing that'll come up on the internet of someone that doesn't have emotion. But it'll be found, if they do enter treatment, which is rare, but if they do, or if they just do some self-exploration, that they actually do have emotions. They're kind of proto-emotions, because they haven't been developed or evolved, because they haven't had any chance to have it be mirrored or attuned to or discovered. And so even with a lot of treatment, 20 years of treatment, someone with schizoid will still have kind of childish versions of the emotions, but at least, they're getting at the emotions. And we need to be connected with their emotions to know what our needs are, right? To know when we need to be hugged, or when we need to have freedom, or when we need to have peace, or whatever, or know we're hungry, or this sort of thing. And for people with schizoid, they can often become quite depressed because they're not in connection with their needs, and they're not meeting their needs. So they can become quite demoralized, and they're extremely lonely, obviously. So, so yeah, they're characterized as being a loner, as not showing emotion. They also will daydream a lot because they learned early in life that to escape the lack of stimulation from the outside is to create your own stimulation through daydreaming or through other kinds of vices, substances or other behavioral compulsions. They learn that the only way to have stimulation and any kind of pleasure, if they even, because they also lack pleasure in things, which can also make them look like they're depressed, and one could argue that they are, but is they can't interact with the world or other people to create those kinds of things. They have to create it on their own, and when they're a child, they turn inward. So that's that explanation of schizoid that I have.
Brilliant.
Oh, well, thank you.
Mind-blowing. I'm now convinced that we have an epidemic of schizoid, probably subclinical schizoid things in like this community and on the internet as a whole. So like my mind was just blown. So I have so many thoughts. But first, two questions. I'm going to have to restrain myself. So first thing is, well, you mentioned enmeshment. And my understanding of this is a little bit different. Definitely not my area of expertise. So you kind of talked about this like personal invasion of space, and you've got a diary and things like that. But like most of when I've dealt with enmeshment, and I may not even be using the term right, but it is almost like an emotional blending, right? So some amount of parentification of the child or infantilization of the parent. Does that qualify for this pattern as well?
It's a type, right? So one type of enmeshment would be parentification, yeah.
Yeah, so but does that correlate with schizoid, or are we talking about a different kind of enmeshment?
It could. Parentification and those more classic types of enmeshments anecdotally isn't as common with schizoid. It's more of brief moments and non-classical types of enmeshment where the parent just doesn't respect the boundaries of the child, like the child's personal space, the child's emotional space, the child's privacy. So that could be parentification, but parentification probably would have more involvement and more contact with a parent, right? And with schizoid, the dominant feature is that they're emotionally being pushed away. And sometimes it's because the parents are good people and good parents, but they're going through things like they're depressed, or a medical emergency, or a chronic medical problem, or war stress, or something, economic problems. So it can, but the lesson that the 2-year-old learns is the same. They don't understand that their parents love them, but yet are struggling with depression. They just think there's no one loves them, and there's no point in turning to anybody.
Okay, so it really is more of that. It sounds like it's more like that random, heavily invasive, kind of like meteor out of the sky, kind of like just very severe. Okay.
Yeah.
And then you mentioned the phrase proto-emotion. Can you help me understand what that means?
Yeah. So when a 3-year-old has, shall we say, empathy or compassion for a sibling or a parent or a puppy, it is not easily understood by them. They don't have the ability to differentiate from the feeling and look at it. They maybe don't know how to manage the feeling in a way that is appropriate to the situation and meets their needs and doesn't invade other people's needs, or if they feel an injustice and they feel angry about something, like a 3-year-old that is not given that second cookie, they feel like there's an injustice and they, throw a tantrum. They don't have the ability to say, well, I feel like there's an injustice, but let's look at this. Or I feel angry in this moment and I want to punch a wall, but I'm a 7-year-old now and I've learned that that's not okay. So for someone that has been putting off and denied their opportunity to learn their emotions and understand them forwards and backwards and be able to differentiate from them, when they discover them at the age of 35, they are just beginning that process and will have a proto awareness, but also the feeling. I see this in my clients, and I extremely rarely will minorly experience this, but I do remember enough about my very early childhood to remember that emotions almost felt different when I was very, very young. They were unbridled, they were all encompassing, and I think more complicated in some ways, more confusing, overwhelming. And so when I have clients for whatever reason are emerging into their body and emotions later in life, the way that they display and report their emotion, in the way that I word it, is proto emotion, but I'm guessing there's other terms for it. But the reason why I will say that is because for clients, they often can be quite alarmed if they are experiencing these emotions and will compare themselves to other people and say, there's something wrong with me. Why are my emotions like this when other people report their emotions like this that are my age? And so I, will have them pump the brakes and say, like, you're experiencing proto emotion. And so we have to go through those steps before it can feel more handleable. So, yeah.
Yeah, super cool. So like I heard so many things there that I think really honestly blew my mind. So I want to tell you about the prototypical healthy gamer. Now, I think that this isn't actually true of the majority of people. It's honestly the minority of people. So when we started out, with this community, I was predominantly thinking about younger versions of myself. So kind of failed out of college and was sort of like lost in life, and then went to India and then found myself. We can talk about that if you want to. And so what I was sort of realizing is what I really needed more than anything else was some degree of guidance, some degree of like understanding of like how I work, how some of these things work. And you're describing the blend of things that I think I experienced, and I think a lot of people in our community experience. So like this sort of, not so much the neglect and enmeshment, but some of the more later manifestations, right? So the more symptomatic manifestations as opposed to the roots. So the first is kind of like turning away from your emotions. So we deal a lot with alexithymia in this community. It's like a major focus of the work that we do. Second thing is this sort of vague demoralization depression. So I take kind of like a more spiritual perspective on it. But I like the way that you kind of describe this like general depression or demoralization that doesn't quite look like a mood disorder, right? It's much more chronic. It's a much more dysthymia kind of picture. So much more chronic. Kind of life has the zest isn't there in life. So it's not that I'm depressed. It's just that since I'm numbing all of my emotions, and when I numb my emotions, I can't selectively numb my negative ones. I have to turn it all down, right? So then these people aren't like depressed in the sense that they're between negative 50 and negative 100. They have a very constricted range of affect. So their capacity for enjoyment is very low. And so it's not necessarily that I'm depressed because of this. It's just that life feels kind of empty and bland and whatever. Right. So this demoralization, depression, and alexithymia picture is something that we do a lot of work on. Then it's really interesting because daydreaming and maladaptive daydreaming, and I would even extend that out a little bit into like random things like a love for anime. So what I tend to find is that these people will, in the absence of this natural connection to your emotions, we require some kind of artificial or hyper stimulating response to get that out of us.
Mm-hmm.
So I've talked with people in our community who just like, in anime, I don't know if you watch anime, but there's like overexpression. It's like overstimulation of emotion, right? It's like when someone is yelling, they're not just yelling regularly. There's like these lines that are moving behind them. I don't know what to describe it, but there's all this like lines moving behind you, and then like their eyes are gigantic, and then there's tears coming out of them. And so like there's almost like this hunger for a hyperactive emotion, because that's what it takes to overcome the dampening effect within me.
Yeah, I never saw it this way, and I'm thinking of a lot of clients and others who absolutely are candidates for this analysis that you're putting forth.
Yeah, and so we see this, right? Because we will deal with things like technology addiction, but when I work with people who are like addicted to technology, I find these kinds of things, a predisposition for daydreaming. There's also other random connections, like maladaptive daydreaming may be a subtype of ADHD, and you get lost in the daydreaming because you lack that executive function, that attentional control, right? And then there's also people with ADHD, there's a subtype that may be an emotional dysregulation subtype. So when you have this attentional, like inability to control your attention, a daydream that has some soothing psychological effect, and some weird stuff going on in your negative emotional circuitry with numbing or whatever, like you kind of create this daydreaming picture. And so it's just really interesting because there's kind of like this like prototypical person in our community who's like really intelligent, really capable, is trying to navigate life, but seems to like not have access to a compass. They don't know what they're doing. They're kind of going through the motions. They're demoralized. That's a great word. They're not necessarily depressed. It's not like they have trouble getting out of bed every day. Some of them do, but like, it's like, I don't understand what the point is. So like life is kind of this shade of gray. And it's really interesting because what you kind of describe in terms of the traumatic upbringing, I think we see shades of that too. Their upbringing wasn't necessarily frank abuse, but there was some degree of neglect, single parent household, a couple of adverse childhood experiences.
Yeah.
And I've never thought about it in this way because I just don't know. I mean, we are taught in avoidant personality disorder, the training that I got was that these people, like something is busted in them and they don't actually crave relationships. But I wouldn't say that my training in the area was very strong or things like that, right? But like I think if you look at even things like, I don't know if the DSM says that these people deep down crave relationships or not. I don't think that's like a part of what I would imagine we would find in the DSM for them. But it makes sense because all human beings do.
Right.
And then the last kind of like thing that you're kind of is really like popping in my head is this idea of a loner, right? Is that everyone says I should have relationships, but I just don't really care for them. And then if we really want to go far out into left field, this is a less tight of a correlation. It's more of a question in my mind. So I think a lot of this stuff maps on very heavily with a lot of what we see. And the last thing is actually some of this stuff around red pill culture, black pill culture.
Black pill, I haven't heard of that one.
So I think it's people who are just very, very demoralized and don't believe that success is even viable. Right? So it's just very, very dejected.
Okay. Life is meaningless.
So yeah, I think they're quite nihilistic.
Yeah,
but
so
not even that life is meaningless. It's that I don't think life is meaningless. I think it's that life is meaningful for some people, but I'm not one of those people. I don't have access to that dimension of meaning, joy, success, love.
Yeah, right. People with schizoid will look at others and go, how do they do that? How do they enjoy things? I wish I could enjoy things. It looks nice. Or are they faking it? What's wrong with people? They feel there's a separation. There's a difference there. Yeah.
So I think there's also a lot of subjective experience of like, am I a robot? right? And so I think we see that a lot where people also say like, oh, am I a sociopath because I don't feel things? So like a lot of this is tracking with stuff that I've encountered. I've just never viewed it through that lens. So that's super fascinating. So in terms of I mean, what is the process of working with these people?
Yeah. So the corrective experience, the therapy, the treatments is among, the consensus among specialists is that it involves awareness and it involves understanding emotion and getting in touch with that, which is a whole thing. Sometimes this is framed as connection with the self or a sense of self, which I could talk a lot about, but that is getting to know your body, getting to know your emotions, asking yourself, what do I need? What do I feel? What do I want? And then also having a relationship with a secure other, ongoing, dedicated, caring, attentive, attuned individual, therapist maybe, or a friend or a spouse or something, who is safe and there and pays attention and might be, so this is the transference problem with schizoid clients, is that I will feel a urge to, what I would say is, draw them out, right? Because I want them to
You as the
feel,
therapist.
yeah, me as a therapist, I'll try to draw them out so that I can show them that it's safe to be in the world, to spread their wings. But if I don't watch it, I will be invasive like their parents were. I will reenact that because of the nature of the situation, and through their projective identification and their transference, they're actually seducing me into a reenactment of that. And so they'll come out of their shell and then they'll start running away. And consciously they think they're actually doing the right thing and doing therapy, but also like going at their own pace. But what that does is it creates these moments where I'm chasing, right? And I might even become frustrated. I might even become angry. And I might feel rejected. And I might start to, if I don't notice it, I might actually go on the attack. And so this is why when you have schizoid and you start to interact, or you have moderate schizoid and you have mild relationships that you're trying to work on, you can actually create these dynamics where the other person will feel neglected and harmed and rejected, pushed away, and the other person will feel an inducement to invade, which will just recreate this whole thing. And then that's why, like with borderline, they assume that everyone is going to abandon them, and so they react against those people, and then those people do abandon them. And so it's the same with schizoid. But the corrective experience is for me to manage that as well as possible over time, so that they feel that, okay, he's close to me and he cares, but he's not a threat, and he lets me have my space when I need that space, because the schizoid is trying to protect their space and their integrity. And so it's one, rare for schizoid people to go to therapy because they don't think there's anything wrong with them in that way.
Or they think it's something that therapy can't help.
Right. They're of the personality disorders, they're one that would believe, like, why would I do that? It doesn't fit. Whereas people with borderline are much more likely to go to therapy because they are more dependent on other people anyway. So, but if they do enter therapy, then I have to navigate it so diligently. It's really hard because at any moment they can just say, therapy's not for me, and just drop it. So I have to draw them out and be in contact, but not make them feel like I'm invading, and not pay too much attention to them because that is associated with invasion and eventual harm. But I can't neglect them. So it's really hard. Personality disorder work is really hard. And a lot of my trainees, when they encounter someone with a personality disorder for the first time, will have a moment of crisis where they come to me and they're just, they're their initial complaint will be more on the surface of like, I have this client who just doesn't seem to be working hard in therapy, and it's really annoying me. And then we talk through it and like, oh, it kind of sounds like schizoid. And then I say, if you're going to be a real therapist, you're going to have to get into the mud, and it's not going to feel good to you. I don't know what you thought being a therapist was going to feel like, but this is the meat and potatoes of therapy is this work, and it's going to feel like shit.
So I think so. Dr. Honda, you seem like an amazing therapist to me, and I'm not. I have to express that. I was debating about whether I want to say that because that'll start this mutual whatever we're into. but I also I think if anyone is wondering, so I think what you just described is such a great representation and advertisement for therapy.
Mm-hmm.
So I think the first thing is like a lot of people will ask like, I don't understand what talking about my problems does. So this is what I want y'all to understand. This is what a good therapist does. Mm-hmm. It's not just talking about your problems. It's about understanding that in your mind, there are all kinds of reactions that are going on. Even if it, with avoidant PD, and I think I've worked with people, never realized I think they had avoidant PD. But I would say that, I developed a kind of like personal technique because I wasn't sure what it was. So the way I would describe it is I would sit next to them and I would eat with them, almost like parallel play. So I'm not looking at you, because if I look at you and I notice you, if I see you and you're trying to hide and you're not ready to be seen, you crave being seen because you want to be accepted, but being seen is dangerous. So I kind of have to I kind of got to like side eye you a little bit. Like I can't look directly at you.
Yeah.
And this is the real challenge, is that I think a lot of people don't realize what a good how transformative a good therapist can be, because there are all these things where if you push too hard, and this also is something that I want everyone to kind of take away, is even this reenactment business is like pure gold, right? So this idea that human beings will do something to trigger you to do something. It's not quite manipulative, but like I think a really good example of this is one of my favorite papers is one called The Hateful Patient. I don't know if you've ever read it, but
Winnicott.
Yeah. Oh, is Hateful Patient Winnicott?
If I'm thinking of the same one, 1949, Donald Winnicott. The Hateful Patient.
I was thinking about it. Maybe it's an allusion to Winnicott then. So I was thinking about a more recent one by Jim Groves. But
okay.
Anyway, maybe I didn't. Maybe I need to read the
I'll
original
go while you're talking so that I can just be reassured.
It makes sense if it was Winnicott, but
yeah. Let's see. Hate in the Countertransference is the name of the famous paper. Sorry. So
yeah. So I think Hateful Patient is Jim Groves.
Okay.
Also a great read. So I think he talks about like sometimes doctors will have patients who are help seeking, help rejecting. So like you may have people in your life like this who are like, oh, I need help, I need help, I need help. And so they induce you to help them. But the moment that you try to help them, they become like a stubborn mule and you're yanking on it and the mule doesn't want to move. And it really frustrates you. And then like I don't know like why I try to help this person. And then they push you away, and then you feel frustrated, and then they do something to make you feel guilty, and then you're back to helping them. That's how they induce the help-seeking behavior, right? So there are all of these dynamics that are going on within all of us all the time. This is how the brain and the mind work. And you have, like, my experience of therapy has been that, most people, myself included, as the one who's doing the therapy, have no idea what, I mean, we have some idea, but, I've seen outcomes that I would not have expected the first time I sit down with a patient. When I do an intake, I have no idea the progress that we're going to make, the directions that we're going to go. And it's all this kind of stuff. Just how thoughtful you have to be as a therapist, how much, if I try to help this person too much, they're not even going to realize, they're going to say, this isn't for me. I'm not getting anything out of this. And so you have to play like 5D, 4D, 5D, 6D chess, right? You have to think about, okay, how is this person going to respond to this? And the reason that we're so quiet is because we're processing all the time. We're thinking about, what is this person feeling? What does this person need? What am I feeling? am I saying this because I need something? You know, how much do I push this person? And if I push this person too much, am I enabling them? Am I actually taking the responsibility away from them? What is the right amount of help?
Mm-hmm.
And so I really love the way that you kind of described that. I don't know how much people got from it, but I think that's like this whole idea of the right amount of pushing.
Mm-hmm.
And then calibrating that. And it's not like there is a right amount or a wrong amount. It all depends on the individual.
Yeah. You can't prescribe it. You can't plan for it. You have to intuit it in the moment. And when I teach this to my students, I tell them, I'm sorry, I can't tell you what to do. You have to just absorb and experience and reiterate and iterate on your form and your intuition. And in the moment, you have to just make a call based on all of it coalescing into a motivation to do something. You know, and the other aspect to the 4D chess is you yourself, I myself as a therapist, have my own relational traumas that I'm reenacting with the client, that I'm inducing them to agree with, and I'm recreating with them. And I have to keep an eye on that too, you know, because it doesn't feel good to be rejected. And I have rejection trauma, as a lot of people do. And so when a client rejects me subtly, I'm going to become a little unglued. And if I don't keep an eye on that as well, then that will become a problem, as it inevitably does at times. But, you know, if the overall experience is monitored and managed well, then, you know, me and the client, you know, go down the road together.
Makes perfect sense. So I want to just be a little bit cognizant of time. So we have somewhere between 5 and 20 minutes left.
Okay.
Howard, does that work for you?
Yeah.
So I'm going to rely on you to guide me on how you think we should spend that. So I'll toss out 3 options if you're okay with it.
Sure.
One is, I want to ask you about spirituality, but that's purely selfish.
Mm-hmm.
Second thing is that I think you've developed a really great framework. And what I was thinking about doing, I've been taking notes. What I was thinking about doing is actually like pulling up like a screen sharing app of my iPad, and then I would kind of write things out, and we would kind of leave people with like a nice like packaged, because I love the framework with which you approach personality disorders, and we could kind of like reconstruct it a little bit. What is the trauma? What does it look like? The third thing that we can do, we had some posts and stuff to react to, but I just couldn't break myself away from the conversation. And the third thing, which may be a good idea, is we can ask questions, or we can open things up for questions, and we can field questions. What do you think we should do?
I'm open to anything. The spirituality conversation intrigues me, and then the Q&A sounds like some people might have questions. So either one of those.
I'm going to ask chat real quick. So like, what do y'all, so do you guys want, so there's a sentiment that, you know, we should do this again. Okay, but it looks like most people, this is tough. Okay, so most people, it seems like, are voting for spirituality. And keep in mind, oh God.
What's happening?
There's conflict.
Among people in the chat?
Yeah, so people feel very strongly about spirituality and the framework. So here's what I'm thinking. So I'm thinking that the framework, maybe what we can do, I think most people are suggesting spirituality. So
we can do the framework another time. I mean,
I was thinking like even with a little bit more formal prep, I think the framework could be super, super strong, right? So like actually, you know what? I'm going to do the framework. We're going to do the framework in 5 minutes, and then does that work?
Yeah, I'm curious.
I'm so conflicted, but okay, let's do it. Let's do it. Sure. I kind of have been doing it. So let me hold on a second. So we're going to do this. I'm going to go to here first. Then I'm going to go browser plus 2cam. Okay, so this thing doesn't work. So they're not going to see your face here. Oh, wait, does this work? Nope.
Yeah.
GG.
Who needs to see my face?
So I'm going to do this. But what I'm also going to do, I got to go over here for a second. And I'm going to screen share with you too, okay?
Okay.
Um,
Curious
you
how
see
you're going to
this?
do this 'cause
yeah,
I always have an impulse to do this as a whiteboard oriented professor, and I fantasize about doing this. So I'm curious how you're going to do it.
tell me about your fantasies, Doctor. Okay, so here's
It
what
involves styluses. What does
um
that mean, Freud?
uh,
Um,
so
are you going
so
to use a stylus? Because
yeah,
sometimes
yeah.
I worry because with mouse, I'm always like,
Oh
if
no,
I
no,
try
I'm
to
going to use a stylus. It's more
Okay.
phallic. Okay, so when we're looking at avoidant PD, okay, so the first thing is that we're going to have a certain kind of trauma. So the trauma is going to be neglect plus forced social situations
Mhm.
plus lack of attunement.
It can be classic abuse as well, like
Okay,
physical abuse and other kinds of abuse.
plus minus abuse.
Yeah.
Fair
So
enough?
yeah,
Okay.
forced. I mean, I would say terrifying social situations is probably more precise because you can force a child and they could enjoy it, but there has to be some level of terror, like
Okay.
and lack of attunement. Yeah.
Okay. Terrifying social situations. And then this creates essentially I'm going to use the word complex. I'm not quite sure what to call it. So, like, in the moment, what is the root issue?
Mhm.
So, and I was going to put perception up here at the top, but I'm going to put perception down here.
Okay.
And the reason for that is, okay, no, you know what? We're going to stick with yours for now.
I mean, it's all kind of in the same category. It's the schema that's developed. It's the
Yeah. So-
defense or the way of predicting the world that the child develops.
So I think that I'm going to go and stick with perception because that's the framework that we talked about today, right? So the perception is that I am fundamentally broken
Mhm.
and other people can see.
Mhm.
Okay? So now what happens, I think if we look at schizoid,
And by the way, people wonder how to pronounce schizoid or schizoid. None of us know.
yeah, I'm using,
I've
I
heard
used to say
schizoid,
schizoid until
yeah.
a expert on personality disorders showed up on stream about an hour and a half ago and said schizoid. So that's the way I'm going to say it now.
Yeah. Yeah.
So we see also neglect. Okay.
Yeah. Mainly
And then
neglect.
plus, let's call it intermittent,
Mhm. Yeah, that's a better word.
intense invasiveness,
Mhm.
plus minus automaton or pet style upbringing.
Mhm.
Fair enough?
Mhm. Yeah.
So I think it's really interesting because, neglect is a feature of both, and then plus a different thing results in a different perception. So the perception in schizoid is what exactly?
Is that my emotions are unwelcomed by me because if I feel them, I have to realize that no one cares. And if I signal, I'll get rejected. And also, if I signal, then it gives the other a chance to get into me, which I can't allow. So I have to turn all the emotions down. So I don't know how to briefly.
Yeah. So
describe
so that
emotions are the
that's
enemy
kind
or something.
yeah. So I think that's more what I understand is the pathophysiology of it, right? But I think the perception is like. That's kind of why I'm trying to work this because this is the subjective feeling.
No one is there for me,
No one is there for me.
and my emotions.
Also, I'm. Can I add something to that?
Yeah, please.
I don't need anyone.
Yep. Right. So some people with schizoid can develop a bit of narcissism, what will look
Yep.
like narcissism. Not always, but that they feel superior to others, you know?
Right. So, and then I think there's also like some amount of, as we've said, like demoralization.
Hmm.
And then also like emotions are the enemy.
Yeah.
And then furthermore, the reason for that is that people can use them as they're kind of chinks in the armor, right? You said that there's an invasiveness that they're afraid of.
Yeah. I mean, the metaphor I use is that it puts the door ajar so that someone can burst in.
Beautiful. Right. And then you were also alluding to not just emotions as they relate to other people, but in your experience, do these people have a perception of their own emotions? And not just in terms of a weak point, but like how do they relate to their own emotions?
Well, it evolves over time. When they're very young, which they might not remember, they consider them a nuisance and they don't like them. They're quite confused by them. And they create pain, essentially. Emotions, even joy, is pain because to feel joy and to show joy only results in pain. It only results in rejection and loneliness and an acknowledgement of, wow, no one is there for me. So early on, it's emotions equal pain, but later on, because of the effectiveness of the defenses, emotions are just not there to them. So they don't really
Okay.
have
Or,
a
yeah, so
context.
the perception is also emotionally numb.
Yeah, numb. Or I just don't have them. You know, I'm
Yeah.
not capable of them. Yeah.
Or perception of sociopathy,
Hmm.
or I'm a robot.
Hmm. Right, because in order to have empathy, in terms of the classic form, you have to feel someone else's feelings. You know, when you were talking about being bullied, I felt the, uh, the injustice and had my own way of dealing with it. You know, and had an emotional feeling and then a reaction. That's one form of empathy. But if you're cut off from your own emotions, then you don't feel your emotions that are triggered by other people's emotions. So it can feel like you don't have empathy. You know, you have the capacity for empathy if you would take notice and connect with your feelings, um, but you aren't given the opportunity to do so. So it's tempting to conclude that you're a psychopath.
Yeah. I think that's so I like the way that you walk us through that, because from a subjective experience, I think it describes really well what a lot of people, why they can, exactly what you said. So I think this is a strong, really resonating subjective kind of experience. And the last thing that I didn't want to leave out was kind of social anxiety.
Hmm.
And I think, like you were saying, the key thing there is that there's some degree of, when calm, insight into the wrongness
Hmm.
of your thoughts.
Hmm.
Right? And sure, lots of asterisks. They're definitely along the similar spectrum from avoidant personality disorder. But people with avoidant PD really, they're convinced that they're this way, right? So it's a little bit deeper. It's a little bit
Pre-awareness, pre-treatment,
Yeah.
they're completely convinced. Yeah.
and with social anxiety, like, people have, and here's my understanding, they have some degree of maybe less severe traumatic upbringing. They have a period of arguably more normal development.
Yeah, probably more attunement,
Yeah.
maybe similar difficult social experiences, but they had parents that were attuned enough of the time.
Right. So I think when I'm hearing you say that, what I'm interpreting is that attunement protects them from the rawness of the abyss. If you're loved enough and your parents are supported enough, you don't think there's a fundamentally broken thing. But as we move more towards the surface of symptoms and stuff like that, the difference is, people with social situations are scary, right? They all agree with that. Social situations are stressful. Avoidant PD and social anxiety agree with that as well. But as we kind of go deeper and deeper in, like at this deep level, people with social anxiety don't quite feel quite as fundamentally broken or unsolvable based on my understanding of how you've described avoidant PD.
As it relates to the social anxiety, because you could have a fundamental sense of brokenness that is unrelated to the social
Sure.
anxiety, if that makes any sense.
Yeah, so BPD with social anxiety, for example,
Right.
fundamentally unlovable, abandonment is inevitable.
Right.
Makes
for
sense.
for the avoidant personality, they actually, the social anxiety generates from that sense of defect. Yeah.
Okay, so that's yeah. So the social anxiety comes out of the blackness within, and if it comes out in this way, then we'd call that avoidant PD. And now we've stopped summarizing, and we've started re-exploring. So, but
professors must have loved the shit out of you because you retain and can summarize like better than I think professors can. You must have been really loved by your teachers.
I mean, I think you did yeah, sure. I mean, some teachers liked me, but I think you honestly, your framework is like awesome, dude. So like I don't think people teach it this way. So and I mean I had wonderful teachers. I don't think they were bad or anything. It's just especially with avoidant PD and schizoid PD, it's just not something we see quite as much, right? So I got excellent training in cluster B. And but like the place that I trained has a unit for like borderline personality disorder. We don't have a unit for I'm going to go and move this over here.
Cluster
and then,
Yeah. It's one of those things that I lament. A lot of my career as a professor, therapist, and podcaster is trying to provide people with what I wish I was provided regarding this topic and others. Because
also protecting
disorders,
me from my bullies.
one bully at a time. Because once I understood personality disorders, and especially when I started reading that people have been understanding personality disorders for over 100 years, so this isn't new. And once I understood, I was like, oh, it's so useful. This is so helpful.
Yeah.
Because the most difficult clients, and frankly, the most difficult family members, are those with, at least on the spectrum, personality disorders. And it explains so much. And once you get it, it's just so helpful. And if you suffer from one of these things when you're provided with this framework, it's so liberating to people. Like, oh my God,
Yeah.
like when people find the subreddit for avoidant personality disorder or schizoid personality disorder, they're just like, I have this and I'm not happy about it, but I'm so glad that I have a label for this and that you all have been talking about. It's important. And the way that it's often taught in graduate school is there's like a module on all the personality disorders, and it's this very surface level explanation by someone that doesn't really understand personality disorders themselves, because they have to understand the entire DSM.
Yeah.
And they just kind of glance over it, and you leave the class with an A and you think you get it when you don't.
Really well said. So I think they're just so, I mean, our clinical training is oftentimes just so dominated by acuity, right? And so we focus so much on suicidality and some of these like very, very like mania and things like that, or at least mine was. But, and so totally get it. And that's why I really appreciated your perspective on it, because I think you really do break it down in a very simple way. One or two kind of last thoughts. One is I wanted to just show you something real quick. I'm going to screen share with you again. So I got to change this for a second. We're going to do this. We're going to do this. I got to figure out the right order of operations. And then I'm going to move you over here so I can screen share with you. But, you were talking about people with, speaking of subreddits, this was on the Avoidant PD subreddit. I don't know if you've seen this post, But if you have avoidant personality disorder, this is what your schedule looks like.
Right. Yeah, and people will literally schedule it sometimes.
Oh, really?
Yeah, I mean, at best, honestly, because they recognize, well, no use beating around the bush because I might as well set aside the time. Because if they rush into the meeting not having psyching themselves up, that can make it worse. Prep can actually help. You know what I mean? It's not where you want to end up. This is not where we're saying, okay, that's the end of the road, but it's better than, just flying into a meeting without any kind of prep or at the last minute not showing up because you make an excuse as to why you're not going to go and then you get fired or whatever. But yeah,
interesting.
That's pretty funny post.
Yeah. So thank you so much, Dr. Honda. I really love this. I think I know people were hungry for spirituality. I'm hungry for it too. It's a big part of our community for some people, but we're not like, we start with really science and clinical perspectives and things like that.
Talking about spirituality whenever I get a chance. I like to ask questions. I'd love to ask you questions about your belief and your journey.
Yeah, absolutely. So I think the other reason I sort of called an audible there, even though I think probably more than 50% of people wanted spirituality, is I felt like if we got into it, we wouldn't have enough time.
Yeah.
And so, and this framework is just too good to pass up. Like it's the best simplification that feels really true to the clinical perspective as well as the subjective experience. It's really cool. So I just wanted to kind of tee that up. But thank you so much for coming. Before you head out, do you want to tell us once again where we can find you? What kind of work you do?
Just psychology in Seattle. Just Google that. That's me.
And Dr. Honda runs an awesome podcast, I guess, where he does all kinds of things, really churns out a lot of stuff. Everything from, so y'all can definitely get more of what we saw here today, because you'll do dissertations on personality disorders, as well as he does a lot of awesome React content. So like, I think does a really fantastic job of taking things that we are all watching and taking all of this knowledge and information and filtering it through a relatively entertaining React piece to like something like Love is Blind. And you're going to learn a lot about how to relate to people, attachment theory. I know we didn't talk about that, but like, I think a lot of this stuff that is really relevant to people. So definitely check out Dr. Honda.
Well, I want to speak to you and to your audience and say that I am very honored to be here. I'm happy that I didn't, at least in my mind, make a complete fool out of myself like I was worrying about this morning. And I know that you are doing so much good work and helping so many people. And you could stop all of it today and sleep well for the rest of your life, given just how much good that you've done and how much education you've given and how many lives you've transformed. And, there's a lot of things you could have done with your life, and you decided to give and to help and, and put yourself at risk, put yourself in the crosshairs of stuff, which happens at times.
Yeah.
And, I just want to,
thank you so much, Dr.
doing
Honda. That means a lot from someone who's been in the field and, for such a long time. And I think your opinion matters a lot to me. I think it carries a lot of weight. So I'm grateful for that. So thank you so much.
Sure.
And until next time, I guess.
Mm-hmm.
Thank you so much. Take care.
All right.
Okay. Yep. Okay. So that was awesome. Yeah, I got to ask y'all, or maybe I should have done this while he was here, but hopefully we'll tell him to watch it. I mean, this is going to be uploaded. So I got to know, what was that like for y'all? Was that is that too much, too deep? I mean, the bromance energy is strong, dude. Like there's going to be some weird bromance meetup with me, Dr. Honda, and Dr. Matu at some point. Like this is a real bromance. And then wait till y'all meet Dr. Thorderson. I mean, y'all have already met Thorderson, so we can't use the word bromance there. And there's just a lot of great people. So like I think this is where like I think HG has to change a little bit. Like Dr. Honda was saying, I'm great at a lot of things, and we do a lot of good work here. That's important. And also, like, guys, I cannot touch that level on some of these topics. Like, the dude is, and I'm not just saying this because, you know, but like seriously, like I'm telling you guys, like when I was learning about personality disorders, I went to so many supervisors, and my supervisors were brilliant in their own way. So the supervisor who gave me supervision that turned into the gifted kids or special needs kids, I will still text her like once a year, and I'll be like, by the way, you remember that supervision that you did? It turned into a YouTube video that has like 6 million views or whatever, however many it has now. I don't know. Had 4.8 the last time I checked, like 8 months ago or something. So like I trained at an amazing institution that had amazingly brilliant people. And also you can take 30 brilliant teachers, and I will learn from those people for 4 years, and I will have my own clinical experience. And there's just no way that we can touch on everything. And to have such a simple explanation of the difference between avoidant personality disorder and social anxiety disorder, mind-blowing. To have such a simple understanding of this is a problem of perception, right? So I said complex because I would add a couple of layers to it. And this could also be by virtue of a difference in our training. So as a medical doctor, I emphasize a lot more about physiology, right? So I think it's not just perception. It's also the way that you're wired, which I'm sure he understands. There's no way he doesn't. So he knows 100% that your stress reactivity system, your autonomic nervous system, we just didn't get into that. That it's perception, it's reaction, it's behavior. But I think the way he described it is the most correct 2-hour way. It's the best way because I think fundamentally it starts with perception, because then perception will then lead to reaction. So like, I think there's just no way. I mean, with people like him, I think we can get perspectives on mental health that are just way better than what I can provide. I'm really good at what I do. Cool. Happy to acknowledge it, happy to appreciate it, happy to receive praise. But in terms of like, I think it's wild. Like there are other experts out there. So, really also awesome to hear how followable this is. So the other big thing for my journey has been understanding. So when you're trained as a medical professional, we're basically taught that patients are very illiterate from a health perspective, which makes a lot of sense. I mean, there's a reason we teach it that way, right? You have to assume the lowest level of understanding on the level of a patient, because we don't want to assume that they know, you know, that you should take a medication every single day. And the stuff that I find really fascinating, I'm afraid that y'all won't be able to keep up. And that's not a reflection on y'all. So first of all, it sounds like y'all were able to keep up. And this is what blows my mind time and time and time again, is how knowledgeable y'all are, how much you can actually follow. So I kid you not, the conversation that we had is a conversation that you will see in a residency program, not even a medical school. The conversation we had is at a level of clinical understanding that is beyond what we teach medical students, hands down. This conversation and the depth of this knowledge is literally what you will find at a top tier residency training program. This level of depth. And I don't know what the psychological equivalent is. But like, and it's cool. So I think it's like it's cool to be able to go deep and really get into some of this nuance and really understand some of these things. And I have a list of 6 or 7 questions. I've got a list of 6 or 7 other talking points, like whole things that could become. So I think this concept of like proto-emotion is just one example, right? So we do a lot of emotional work here at HG, but how can we help you evolve from a proto-emotion to a full emotion? And good to know. So thank you all so much for coming. Really am sorry that we couldn't get to questions, because I'm sure that y'all have such good questions. There's no doubt in my mind that the questions are worthwhile and should absolutely be answered. We didn't get to spirituality, so I think we just got to do it again. Reach out to Homath. I don't know what that means. Is that a person? But okay. Will the VOD be posted? Yeah. So the VOD is gonna. Part of the reason we dual stream and we have a YouTube channel is because Twitch doesn't store VODs for a long time. One of the things that we learned is that this stuff should be stored somewhere. So there's a VOD on YouTube, and we may edit in some way and post on YouTube as well. But absolutely, right? So we love live streaming, and also this should be accessible later. So definitely check out Dr. Honda, and I think he does a lot of great stuff, but I think we're going to try to see if he's open to doing more. And then I think like the chemistry is legit. So I think that there's something that we can do together that will be greater than what I can do and greater than what he can do, or different, let's say. Yeah, so all VODs are going to be available on YouTube. And once they expire on Twitch. Okay? So thank you all so much. And yeah, can we get a cleaner version of the iPad stuff? Maybe in post. All right, so that stuff like you guys know, like when we ask y'all for money and we ask y'all to buy things, like, right? So if you guys like want to understand trauma, I highly recommend Dr. K's guide. Y'all can sign up for coaching and stuff if you want to. So like some of the stuff, so I don't know if y'all have seen the guide videos, but the guide video iPads are beautiful. And like that takes funding to do, right? We got to hire someone who's like, a digital artist or something. I don't know exactly how they did it, but there's like a whole process they go through, and it's like a lot of work. So I even bought a handwriting book, because I was like, I got to get better at handwriting. But I didn't start out with great handwriting, and then I went to medical school, which just absolutely slaughters it. And then we just never recover. Sometimes I can't even read my own handwriting. So, it's a work in progress. We're all a work in progress, chat. So take care, y'all. And we'll see you when we have something next. And huge shout out to Dr. Honda. Take care, everybody.